Katrina with MCVP. I am here for another edition of our Ask an Advocate series. Today we are talking with Lindsey Cushing and Kelsey Page from the Cheshire Medical Center about the SANE program there. Would you, Lindsey, Kelsey, like to tell us a little about yourselves?
Sure. So my name is Lindsey Cushing. I am a women's health nurse practitioner and a sexual assault nurse examiner. Kelsey and I completed our training at the same time in 2017. And this last fall, I was certified as a sexual assault nurse examiner for adults and adolescents. Certification is a process you have to go through to meet certain qualifications and testing standards. We work together on the sexual assault response team for the county. And both of us also attend the quarterly New Hampshire sexual assault nurse examiner meetings that happen a few times a year. And we respond to calls that come in from the emergency department when somebody presents looking for care after a sexual assault.
Great, thank you. Kelsey.
Great. And my name's Kelsey Page. I'm a nurse that was previously working in the emergency room. I received my SANE certification it was in 2019, and then I've been a SANE nurse trained since 2017 with Lindsey. We completed the training at the same time. So previously I was in the emergency room taking care of patients as well as folks that have experienced domestic assault, domestic violence or sexual assault. And now I'm up in women's health seeing folks up here as well.
Great. Thank you. So I wanted to talk to you today because a lot of our clients, particularly ones who see us for sexual violence, get really concerned about going to seek medical care. And so I want to talk to you a little bit today about the SANE program, and hopefully we can ease some of those tensions and fears and really get some good information out there for folks so they understand just more about their options after an assault. So can you tell us what a SANE exam is and what maybe some of the different elements of it are?
Sure. So a sexual assault nurse examiner, also known as SANE, just a little bit shorter, is a registered nurse or advanced practice nurse practitioner who's been specially trained to provide some comprehensive trauma-informed care to folks who have experienced assault. So this includes conducting the collection of forensic evidence if that's something that they decide to have done. The reason why we really want to see you for healthcare after an assault is because it's really essential to your health and safety moving forward. You're in control of the exam. You choose what parts of the exam are done or skipped over, or you can stop or take a break at any time. So during the exam, we really just talk about what happened, and we document all those, your story. And based on that, we'll ask some follow-up questions. We do a head-to-toe medical physical exam and document any injuries that we might find during that as well. So after we kind of talk a little bit more and document any injuries, we would then have a conversation about options for an exam, including a SANE kit. And there's a couple options for that kit. There's a reported kit, which means that, at some point you will be talking to the police, either at the hospital. Sometimes people have had contact with the police beforehand. And then sometimes it'll be kind of during the process of the exam in the emergency room. And that would mean that your case would move forward with some police involvement. There's also an option for an anonymous kit, and we'll talk a little bit more about that later. But really, no matter whether or not you choose to do a kit, we would do a medical forensic exam, which part of that component is that head-to-toe physical exam. And we would also we would talk about like medications to prevent pregnancy, prevent transmission of STDs or HIV that you might have been exposed to, and kind of go from there. So if you decide to complete a kit and have the evidence collected, we'll fill out some paperwork and get some details about what happened during the event. We collect a mouth swab. It's just a little Q-tip that's your DNA. And so when your kit goes up to the crime lab, the crime lab knows what your DNA is, and they would also be able to identify any foreign DNA from somebody else that might have, you know, been able to be collected as a result of the assault. So based on your description of the events and with your consent, we would collect any potential evidence using those Q-tip swabs from different locations on your body as well. And if you have female body parts, we would also offer a speculum exam, which is a vaginal exam, and that would collect potential specimens from inside your vagina. And it would also allow us to look to make sure that you don't have any internal injuries. So we would document all of those findings as well on our paper charting. And all of that paper charting is kept separate from your digital medical record. And only a limited number of folks have the ability to access the chart. We also offer during exams to take photographs that would help further document your exam. And these photos are burned onto a disk and they're encrypted and they're very safe. They're not part of your medical record, and they would be used only in a court case if you chose to report the assault. So regardless of that kit collection, it's really, we really want to see folks after an assault so that we can make sure that you're safe and that we have the ability to make sure that you're okay physically and emotionally. Like I said, we offer medicines to help prevent pregnancy, reduce the transmission of STDs and HIV. And we can offer some follow-up care and resources to ensure that you're safe.
Great. Great. Anything that you wanted to add? Lindsey, that was pretty thorough.
Yeah, I think just another big thing too is that something that is often underreported or not thought to be as serious as it really is strangulation. And or, you know, some people might refer to it as choking, but, you know, medically refer to it as strangulation because they are a little different. That is one of the things that can happen during an assault, even if it's really brief, that can actually have really severe medical consequences. And sometimes those symptoms or the effects from strangulation are delayed. So even if immediately after an assault you feel physically okay, you just kind of want to go into your house or wherever, go to a safe place and just be by yourself, and you don't really want to be seen. If ever anybody ever has their hands around your neck, on your chest, and there's some form of restricted breath or airflow, that's really something that needs to be evaluated medically to make sure that you're okay, because we would hate for something to happen where, you know, a few hours from the assault when you're home and maybe don't have access to care or don't have anybody with you, you could start having symptoms come up later. So that's a big part of why we want to see people.
Great, thank you. Yeah, I can certainly understand, like, some people would not think that that is one and the same, even if it occurs at the same time. A lot of our clients that we see, you know, it's only after a few conversations that, you know, that we tend to get some of these details for sure. And so who is able to receive an exam?
So anybody that's been sexually assaulted, we want to make sure that they touch base with either their primary care provider or the emergency department. The time frame is important for who can receive a SANE exam. When it comes to an acute assault, so an assault that's just happened, you know, the sooner people can come in, the better. At Cheshire, right now, we are only performing exams for adolescents. So those who have passed through puberty, so girls who are menstruating, boys who have gone through puberty, and then adults. Children get referred to the Child Advocacy and Protection Program, the CAP program at Dartmouth, because child abuse tends to be more chronic and doesn't tend to be reported kind of acutely. If somebody had really acute, serious medical concerns, if there was medical concerns for a child, certainly they'd be seen and evaluated in the emergency department. But for kind of like the longer workup and evaluation and management of that, that would be done with the specialty program at Big Dartmouth in Lebanon. For adults and adolescents, If somebody's been sexually assaulted within the last 5 days, we can still collect forensic evidence if they want to. And we can do that medical forensic exam in the emergency department. If it has been more than 5 days and you haven't been seen, we still usually encourage people to come in, but instead of being a SANE exam, what it might be instead would either be a follow-up with your primary care provider, or you could come to Women's Health and see me in Women's Health or another provider in Women's Health to do a medical exam to make sure, again, that physically you're okay, to check on injuries, to do STD prevention or testing. And after 5 days, the pregnancy prevention window has kind of closed, but we could also do a pregnancy test and kind of do follow-up for that to make sure that somebody wasn't at risk for an unintended pregnancy.
Great. And what if, say someone presents, but they're under 18, what changes then for SANE exam or?
Sure. So there are some times that people under the age of 18, obviously you do have that right to care, whether or not parental consent is given. So that being said, we are mandated reporters to the state for anyone who's under 18 or who's a vulnerable adult, or like a couple other situations, such as like if somebody has sustained a gunshot wound or had serious bodily injury related to the assault, we have to report those things just to make sure that there's some safety and follow-up planning. So yeah, that would be certainly we would still see those folks under 18. Usually we try to involve the parents at some point during the process, but that's, with the patient's consent as well.
Great. So someone that is, say, like 16 could still get a SANE exam, but reports would have to be made to law enforcement or DCYF or.
Yes. Yep.
The other important thing, I think, is also the concept of assent. And so consent can be given, obviously, from somebody. So consent is when we have somebody saying, yes, I want to do an exam. I want to collect evidence, whatever it may be. And so adolescents can consent to an exam, but it's also important that they assent. So when, if a parent is involved and say somebody who is under 18 was brought in to the hospital by a parent because there had been a concern of an assault or something like that, then if the parents are saying they need to have an exam, they need to have evidence collected, we require that victim or potential victim, however they identify, they have to assent to that. So we will not do an exam or collect evidence unless the person who has been potentially victimized or has been victimized is telling us that they want that done. So we would never do an exam or collect evidence from an adolescent who is saying, I do not want to do this.
Great. Thank you for that. As the prevention educator, I primarily, am in front of teenagers and tweens. And so I think it's really important that they know that they do have those options. And also that they know, that reports have to be made. I think so often they just sort of, yeah, of course, I can tell somebody. And if they do tell at all, sometimes it's by accident. So thank you for that. And so what can someone expect then? Let's say they are over 18, they go to the emergency room after an assault, say it's within that 5-day window. What can they expect when they arrive?
Sure. So you would arrive at the ER and register at the front desk through the waiting room. And, this situation can be really hard to tell somebody else, especially a stranger, what's happened. So, you can tell registration, why you're there in multiple ways. You can just tell them what happened, or you can say, I just need a SANE exam, and they know what that means and what to do from there. So it might be a few minutes of waiting in the waiting area until you're seen by the triage nurse. And what they'll do is ask you some basic questions about why you came to be seen, but you don't have to tell them any details that you don't want to. From there, you'll be brought back to one of our exam rooms that we have for patients that have experienced traumatic events. It's a private room with a private bathroom, and it's a really safe area. So if a SANE nurse isn't working on the floor at the time that you arrive for care, one of us will be paged, and we'll come in from home anytime. We're available day or night, 24/7. So while you're there, and even before you come in, we do try to have you wait to eat or drink anything, to change your clothes if that's possible, until being seen by a SANE nurse, as you might have evidence on your clothes or your body that we could, with careful care, essentially, we can protect and preserve that evidence if that's something that you choose to do during the exam. From there, we also call MCVP, and you can speak with one of the advocates over the phone or in person. Hopefully, when COVID gets a little better, we'll have some in-person visits as well. And those are really just to ensure that you're supported. You know who to call if you have questions after you leave the emergency room, and they can also come up with safety plans. We would then talk about the options for the SANE exam, including the kit collection. And after the medical forensic exam is complete, we talk about discharge planning, including needing follow-up care and safety planning. So Lindsey and I both work up in women's health now, but while working out of the emergency room too. So we'll more than likely be the people seeing you for follow-up if you choose to follow up in women's health. And everybody has the right to follow up here, no matter how you identify.
Yeah, and that was one of the points I wanted to ask too. Was is anyone, regardless of gender, able to get a SANE exam? I think a lot of times there is that misconception that some of these services are just for women or people who identify as women, and so thank you for saying that for sure. And so my other question then is, so if somebody were to go to the hospital, say they wanted to schedule a SANE exam, but they wanted to do it during normal business hours in women's health, would they be able to do that as well? I mean, I obviously have to make an appointment, but.
So unfortunately, SANE exams we can't do in women's health, at least not right now. An actual SANE exam takes a pretty significant amount of time. And so there's, in addition to, obviously it's not something we want to rush. We want to let people have as much time and space as they need to be able to do a SANE exam and feel in control of the situation, have time to take the breaks, and have access to a private bathroom. And that's just not something we have the capacity for in women's health. For us as SANE nurses, because there's so much paperwork and so much kind of careful completion of that paperwork, and then also all those different pieces of evidence that we have to collect and make sure we're packaged correctly, it can take us up to 6 hours to actually complete a full exam. Doesn't mean that the person is there with us, the victim is there with us for all 6 hours, but it takes us a long time. So unfortunately, because of the way that we schedule things in women's health, we don't do SANE exams in women's health, at least not right now. If though somebody was interested in coming to the emergency department at a set time, that certainly is something that we could help figure out. And so if somebody knew that they were going to be off of work, tomorrow, or they weren't going to have childcare till later in the day, you can call anybody in the clinic has access to the same pager number. Either Kelsey or myself is holding onto this pager at all hours of the day. It's in theory supposed to be just used during business hours, but we always have it. And so if somebody is calling and wanting to try to arrange coming into the emergency department during a set time, we can help organize that and make that happen.
Great, thank you. And so one of the other concerns that we have, especially for some of our folks that come from out of state, or is what is the cost of a SANE exam, and is insurance billed? Particularly, I'm thinking of like a lot of our college students get very concerned that they're on their parents' insurance, and now that's going to be billed, and that's going to create a whole tidal wave of things that they don't want.
Yeah, so there are federal laws that prohibit the billing of a victim for sexual assault services and medical services. So nobody is ever or should ever be billed for a sexual assault exam or any of the follow-up care that they've received as a result of that sexual assault. When we see you in the hospital, we actually will go through a billing form with you and give you options. You can ask your insurance to pay for your care, but if you don't have insurance, or if you don't want your insurance billed, maybe you don't want your partner, your husband, your parents, or whoever else is on the insurance with you to know that you've received care, we can actually just bill through the state. And there is something called the Victims Compensation Fund, which is kind of like a slush fund for when people get traffic tickets and parking tickets. A lot of that money that comes in from those kinds of tickets and fees actually goes into the Victims Compensation Fund and helps cover the cost of sexual assault care for people who don't have insurance or don't want to bill their insurance. And that's true also for follow-up care, missed work, child care expenses. So the Victims Compensation Fund will work with people after a sexual assault to make sure they get all of those ancillary costs, not just medical costs, but all those other ancillary costs covered.
Great. Thank you for that. And so what if, so we talked a little bit about people either, having a reported kit or doing a kit anonymously. What would you say what are the options for folks, whether they want to do an anonymous kit, and maybe some even saying, well, I'm not going to report to law enforcement anyway, so I don't want to have this kit done. Do you think that, I guess, can you just kind of explain how an anonymous kit is created, and then, if you think, and just based on opinion, if you think there are still benefits of having one, even if at that moment you don't think you're going to report?
Sure. So there's definitely benefits to collecting that evidence, whether or not you were in the headspace at the time of the exam to move forward with the case. It's certainly a patient's right to decide whether or not they report to law enforcement, and really whether or not you get the kit collected either way. But there are, like I said, benefits to really preserving that evidence as soon as possible, just in case, later on they choose to move forward. What happens with the kit is it's collected in the same way, whether or not you choose to report or have an anonymous kit collected. And you can also kind of change your mind halfway through. If you decide, we get through this and you're like, I really don't want to do this anymore, or yes, I do, it's easily, altered either way. Sure. So if you were to choose to have the kit collected anonymously, what would happen is every kit is assigned a number, and no part of identifying your name or your date of birth, anything goes on the kit or any of those forms. The only thing that ties you to that kit is that same number. So what would happen if, say 2 weeks down the road, or later on, even further from there, you have the ability to call the either the town or the city that the assault occurred in, that police department. So say it happened in Keene, you call the Keene Police Department and you say, hey, this is my kit number, and I'd like to move forward with the case. They will get you in contact with a detective. The difference with the kits also is that the anonymous kits don't get analyzed for evidence until you decide to move forward with the case. So we don't, the crime lab doesn't open that case, open the kit and analyze any of that for DNA or anything like that until you decide to move forward with the case.
Great, thank you. Yeah, and I just wanted to remind folks that there is, a statute of limitations for moving forward with criminal cases in sexual assault. If you're under 18, when the assault occurs, then you have until your 40th birthday to do so. If you're over 18, you have 6 years to move forward with a criminal case. So there's certainly, obviously it's up to you as an individual whether or not you get a kit done. However, you may feel differently 3 years from now after the assault. So there is, some benefit in at least, weighing out your options there.
There's also other complicating factor is that the crime lab, the police department technically is only required to hold on to anonymous kits for 60 days, even though generally the practice is that they just hold on to them indefinitely. That is not necessarily that's not required. And so, so unfortunately, there is a bit of a time clock when it comes to the evidence kit and transitioning it from an anonymous to a reported kit to ensure that that evidence is still there and that the kit is still there. So that 60-day mark is really important. Victims do have the right to call the police department and the crime lab and to request that they be notified before their kit is destroyed and ask that it be held on to. So if you're approaching that 60-day mark and you're still not sure what you want to do, you can call and give the kit number and say, I want this kit preserved. I'd like to know if it's going to be destroyed because I'm not sure what I want to do yet. But that 60-day mark is really important to kind of keep in mind.
Thank you. So anything else about the SANE program that you think people should know that we haven't covered today?
I think just, in terms of being your own advocate, one of the things that Kelsey said, and I'll just hit on again because I think it's really important, is that, right now and in a lot of places, when people have to seek care, there's a lot of disclosure that has to happen. And there are a lot of people that you have to disclose to in order to get the care that you're wanting and needing. It is your right to tell people what information you want to tell people. And so sometimes people ask for information, even in a clinical setting, when they don't really need it. Sometimes it's because they're trying to be helpful, they're trying to information gather. As clinicians in healthcare, we're trained to get as much information as we can. Mm-hmm. But when people aren't especially trained in sexual assault and trauma, sometimes they don't realize that actually getting that information can be re-traumatizing. So we certainly don't want people having to disclose more frequently, more often than is totally necessary. So it is your right to disclose what you want to disclose. It is also your right to tell people, I'd rather just talk to the SANE nurse. The most important things when you see somebody who's not your SANE nurse is to let them know if you have a really serious injury that you're worried about, if there's been an episode of strangulation. Those are probably the most important things. If you have an immediate safety concern, that would be important for you to let the triage nurse know or the physician. But when it comes to the nitty gritty and the details of what happened, where it happened, that kind of stuff can really be reserved for just you and the SANE nurse. And even then, totally your choice what you disclose to the SANE nurse. So just know that that's your information, that's your story. It's your right to hold on to it and to choose who you disclose to, how often and when.
Awesome. Yes, thank you so much for that. That is definitely a point we try to get across for our clients when they do seek care from our services from MCVP. So, thank you so much for including that too. Kelsey, anything you wanted to add?
Yeah, I'd love to add on that, even if you don't know where to go or don't want to show up in the ER, we're here in the office setting, during normal office hours. If you don't know what to say or don't know where to go, we're always here. And if you don't have a way of getting to the emergency room to seek care, always call 911 and, EMS as well as the police officers are trained to help facilitate getting you to a safe place and getting you to the emergency room to receive care that you need.
Yeah, thank you. Thank you. Yeah, and if you do want, assistance from an advocate, MCVP is also sometimes available, and I can't say always available, to bring you to the emergency room to have a SANE exam done, but or to seek other medical care after an assault. But that is a service that we try to provide as much as possible for our clients too. So sometimes having the EMS and the police there can be a little bit scary for folks. So, you know, but if we're not available, that option always is for sure.
And if somebody can't get in right away, don't think it means you can't come. And if you're questioning, should I change my clothes? Should I shower? Like, what do I need to do until I come in? You know, that's a question we can answer too. And so call Women's Health, call the emergency department, ask them to page the SANE, and we can answer those questions to try to help make sure we take good care of you until you're able to get to the emergency department.
Awesome. Awesome. Thank you. That's so great. Well, thank you so much for doing this and being, you know, a part of this series for us. I think you both are completely invaluable assets to our community. So I definitely appreciate what you do, both of you. Thank you so much.
Oh, it's a pleasure. Thank you very much. Thank you for what you do.
Thank you. All righty. Well, thank you everyone for viewing and watching with us today. My name is Katrina Nugent. I'm the Prevention Education Director for MCVP. If you do have any questions about sexual assault options afterwards, please give us a call at 1-888-511-6287. Thank you.